Hello everyone, I am Mrs. Angeline Kirabai, Assistant Professor, Department of Biotechnology, St.Josephs College of Arts and Science for Women, Hosur. Today we are going to see about what is dengue virus and about dengue fever. Dengue is currently one of the world's most important neglected tropical disease. It is a viral infection caused by the dengue virus transmitted to human through the bite of infected mosquitoes. About half of the world's population is now at the risk of dengue, with an estimated 100 to 400 million infections occurring each year. Dengue viruses are spread to people through the bite of an infected Aedes species, that is, Aedes aegypti or Aedes albopictus mosquitoes. There are four dengue types of viruses, that is dengue virus 1, dengue virus 2, dengue virus 3, and dengue virus 4, all of which are capable of inducing severe disease like dengue hemorrhagic fever, that is called as DHF, and dengue shock syndrome, that is called as DSS. Classification of dengue infection based on WHO. Dengue illness is clinically classified as either dengue with or without warning signs or severe dengue. In 2009, WHO classified the purpose of improving clinical management. The assessment of warning signs is designed to permit the early identification of patients with more severe disease manifestation who require supportive therapy. Dengue illness can also be divided into three separate phases. First one is acute phase, critical phase, and convalescent or reabsorption phase. The next one is mode of transmission of dengue virus to human. An Aedes aegypti mosquito can become infected by feeding on a person in the viremic phase of infection. During the extrinsic phase of the cycle, dengue viruses first infect a mosquito midgut cells and other tissues before disseminating to the salivary glands. An infected mosquito can then transmit the dengue virus to several humans through bite. Once infected, it takes an average of 4 to 7 days for the onset of symptoms. These are all the symptoms of dengue fever. Symptoms which usually begin 4 to 6 days after infection and last for up to 10 days may include sudden high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash, which appears 2 to 5 days after the onset of fever. Then mild bleeding. Then what are the diagnosis? PCR test, that is polymerase chain reaction, is a type of molecular test that is used to check for dengue. This test can be done during the first 7 days after your symptoms begin. And treatment for dengue fever. There is no specific medicine to treat dengue infection. If you think you may have dengue fever, you should use pain relievers with acetaminophen and avoid medicines with aspirin, which could worsen bleeding. You should also rest, drink plenty of fluids, and see your doctor. If you start to feel worse in the first 24 hours after your fever goes down, you should get to the hospital immediately to be checked for complications. And preventing dengue fever. The best way to prevent the disease is to prevent bites by infected mosquitoes, particularly if you are living in or traveling to a tropical area. This involves protecting yourself and making efforts to keep the mosquito population down. To reduce the mosquito population, get rid of places where mosquitoes can breed. These include old tires, cans, or flower pots that collect rain. Regularly change the water in outdoor bird baths and pets' water dishes. Risk factors. If you or travel in tropical areas, being in tropical and subtropical areas increase the risk of exposure to the virus that cause dengue fever. Especially high risk areas include Southeast Asia, the Western Pacific Islands, Latin America, and Africa. If you have had dengue fever in the past, previous infection with the dengue fever virus increase your risk of severe symptoms if you get dengue fever again. Complications faced in dengue fever. Severe dengue fever can cause internal bleeding and organ damage. Blood pressure can drop to dangerous levels, causing shock. In some cases, severe dengue fever can lead to death. Women who get dengue fever during pregnancy may be able to spread the virus to the baby during childbirth. Additionally, babies of women who get dengue fever during pregnancy have high risk of preterm birth, low birth weight, or fetal distress. Conclusion. Severe damage fever is a life threatening medical emergency. Seek immediate medical attention if you have recently visited an area in which dengue fever is known to occur. You have had a fever and you develop any of the warning signs that include severe stomach pain, vomiting, difficulty breathing, or blood in your nose, gums, vomit, or stools. If you have been traveling recently and develop a fever and mild symptoms of dengue fever, call your doctor. That's all about dengue virus. Thank you.